Good afternoon, North Dakota. Thank you for tuning in. We've got a number of guest speakers today, including State Superintendent Baszler will be with us again today. Vern Dosh, who's acting as our state contact tracing administrator, and Molly Howell, our immunization program manager. I want to start off today with some fun news, some good news. Last week we launched the Mask Up North Dakota campaign and asked you to partner with us to be North Dakota smart and wear a mask when you can't social distance. And of course, lots of scientific evidence out now that masks do help slow the spread of this. And of course, you wear it for yourself and your family members, your friends, and also for your loved ones that might be vulnerable or people that you don't even know that might be vulnerable. But one of the things that we did as as the part of the #MaskUp campaign, as we asked people to post pictures of themselves wearing a mask and then a sign with the name of the person that they're wearing for, who they might be wearing for, because they might have someone who's healthy that wears a mask. They're doing it to protect the lives and livelihoods of others. And we're showing a number of them here, but we've had posts from all over the state. But CHI, St. Alexis Health in Dickinson, Faith Lutheran Church in Bismarck, Chandeska Chicana Community College up at Spirit Lake Nation near Devil's Lake, just among the few that did a great job of their team members who joined the Mask Up North Dakota campaign. And again, we encourage you also to go out there to health.nd.gov/maskupnd, download, print off a poster, take a photo of showing who you mask up for, post it on social media using the #MaskUpND. So thank you for all that you're doing. You're doing something that's really cost effective, low cost, and highly effective to help slow the spread of COVID in our state. And timely that we led with that, because the numbers are not headed in the right direction right now in our state of North Dakota. So more important than ever that people be smart about remembering the North Dakota SMART guidelines, the simple ones like socially distancing, if you can't, wear a mask, etc. But let's just talk about the numbers and share what we're watching right now. We've got currently 1,209 active confirmed cases in North Dakota, and that's the highest level of active cases that we've been at in the pandemic. Over the past 7 days, and that would include through midnight last night in terms of reported tests, so the 7 days leading up through yesterday, August 18th, we had 1,003 cases over the last 7 days. We had 757 newly recovered during that time frame, and we our positive rate for the last week, take the whole 7 days together, was 2.9%. We like being under 3. That's a good place to be. We got a lot of testing done in the last week, 34,000 plus tests done in the last week. That brings us to over 400,000 tests that have been completed since the beginning, and 182,000, more than 182,000 unique North Dakotans that have been tested. That's nearly 1 in 4 North Dakotans have been tested, and many have been tested more than once. When we take a look at the rolling statewide average and where we may have some concern, well, again, the statewide average there in white is below 3%. That's a good place to be relative to the rest of the nation, still among the lowest in the nation, below 3% for the statewide. The blue line is Cass County, which was above for the beginning months of the pandemic and is now below. The yellow line is the Burley-Morton line. But if you look at the tail end of those, all of those on the 14-day rolling average, both, whether it's Cass, whether it's Burley-Morton, whether it's a state average, and a number of other counties around the state, it's ticking up a little bit. Yesterday at 7.2%, it was a low testing day coming off the weekend in terms of number of tests, about a third less tests, but still a high number of positives, 188 cases. That's, I think, close to one of the highest number of case days we had, and it's the highest percentage day yesterday. We had at 7.2 from highest that we've had since back in April. And again, still digging into that, again, because it's a little bit of an aberration on here. There may be a bit of a reporting lag in there, but today's number, 3.9, also above our trend line of the 14-day trend line of 2.8% is the trend line for the last 14 days. So when we have days that are above that 14-day average, that's going to start bringing it up. So we like to have days that are below that. We want it to come down. And again, particularly Burley-Morton, the rolling average for Burley is 4.2% positive rate. Morton is 5.1%. And so again, we'll talk more about that going forward, but that's again, area of concern right here in Burley-Morton. In terms of hospitalization, we stand in very good shape on hospitalization. This is one of the things we keep a very close eye on. Currently, there are 49 people hospitalized, down from a peak earlier in the last few weeks, but these have remained relatively flat. And of course, as we've talked about a number of times, this is a statewide number that 49 are hospitalized with COVID, and we've got thousands of hospital beds in the state of North Dakota. So there is in some parts of our state high demand for hospitalization, but as reported, most of that is some of the pent-up demand for deferred surgeries or deferred seeking medical assistance related to things that might have been skipped back during March, April, or May. So there is some demand surge as people try to catch up on important medical procedures. But from a COVID standpoint, COVID is not the thing that is driving high hospital utilization in the state right now. Again, it represents only single digits of the hospital beds in the state being utilized. When we take a look at long-term care, we continue to be in quite good shape in long-term care, but every time we end up with a resident that becomes infected, that creates a risk because if they're in a long-term care facility, whether that's basic care, assisted living, or skilled nursing, that's a risk not only to themselves, because if they're in long-term care, they probably have underlying health conditions and need that additional assistance, but it's also a risk to all the other residents that are there because of how easily this virus can spread. So we must continue working hard to keep COVID-19 out of all these facilities which house our most vulnerable citizens. And we do know there is a correlation that seems to be emerging between counties that have higher prevalence, and then also those counties with higher prevalence, then we end up with more risk that staff and visitors might bring the virus into the residents. So again, particularly if you're a staff individual or a visitor visiting a loved one in counties that have higher case numbers, exercise even more caution in these cases because of the potential of carrying infection in. Since the last 7 days, sadly, again, we've had 10 deaths over the last 7 days, and that brings us up to 130 total deaths during the pandemic. 8 were reported prior today. 7 of those 8 were individuals with underlying health conditions. All of them were, except for one, all except for one was an individual that was over the age of 60, but some in the 70s, 80s, 90s, and even one gentleman from Grand Forks over 100. But today we also report that a woman in her 70s from McLean County with underlying health conditions and a woman in her 90s from Grand Forks County with underlying health conditions. So again, that's the total of 10 deaths over the past 7 days. And as always, our hearts and prayers go out to the family and friends who've lost a loved one during this time of COVID-19. In terms of active cases across the state, again, we see fairly wide spread now. 46 counties out of 53 have at least one active case right now in the state, but which that does mean we do have 7 counties that have none, which is great for those 7 counties. And again, with some bit of caution on this, we do have, if someone tests positive, gets a test in North Dakota, but their address is out of state, then they would be reported in another state's data. So there's always a possibility that you could end up with having more active cases than we're showing right here because of individuals that may have tested positive but have an out-of-state residence, and again, that's something that could become something we need to be increasingly aware of as we head back into college season. When we take a look at counties where the active cases are, again, the total number, the highest number of active cases in the state are found in Burleigh County, 324 cases in Burleigh County. The number 5 county is Morton with 107. So those combined, 431 of the cases in the state, or 36% of the cases in the state, are in Burleigh Morton, and those 2 counties only represent 17% of the population. But other places we're, again, keeping a close eye on. Grand Forks at 142 cases, and Stark County actually comes in number 3 in terms of the in number of active cases, but because of the lower population, when we take a look at active cases per 10,000 residents, we see that both Stark County and other counties in the state with lower populations actually you have the highest probability of in terms of maybe not highest probability, because hopefully people are quarantined and isolated. We'll talk about that later. But just in terms of the sheer number of active cases per 10,000, it's high. And for example, again, in Stark County has a per capita rate that's 7 times higher than Cass County right now. So we'll continue to pay close attention to these counties that seem to be continuing to climb on a number of active cases and active cases per capita. Today, after a tremendous amount of great work by our health analytics team in the Department of Health, they've worked tirelessly to make sure that we've got some of the best displayed and most current data to share with the public. It's the public's data. We want to make sure that that information is out, and particularly as we head into school season, so that school board members and superintendents and parents all can make informed decisions at the state and local level. So the new dashboard was released today. It's available at health.nd.gov/COVID-19 dashboard, and it provides county level breakdown and will give the public a clearer snapshot of things that we watch, like hospitalizations, active cases, positive test rates, but it also now has aggregate cumulative data on age, race, and gender, among other things. And so again, this is interactive. Lots of buttons you can click on these, and they will update and change, and slider bars. I mean, it's really well displayed. So again, all gratitude out to the health analytics team for the great work that they're doing. And again, use it as your clearinghouse for COVID-19 information in North Dakota. And again, check it out at health.nd.gov/COVID-19 dashboard. The Burley-Morton task force update. As I said earlier, we've got our highest number of active cases right here, 431, 36% of the active cases. And when we formed this several weeks ago with the goal of bringing the 2 counties' positive rate in line with the state average, we wanted to duplicate the success we had in Cass and Clay counties. One of the ways that we were successful in doing that in Cass and Clay County was by increasing the availability of testing, particularly for those populations, those communities, and those neighborhoods that may not have had access to transportation, or maybe because they're working, can't get it done during the day, or because of financial reasons weren't able to get a paid test or lacked insurance. But our goal by next week is to have testing available every day of the week in the Bismarck-Mandan metro area. And this week, the only day we're missing is Thursday, but we're working to add an additional testing site to fill in on that Thursday, again, serving this community. We want to thank the Bismarck-Mandan Chamber, the EDC, and the Convention Visitors Bureau. They're also jumping in the fight and stepping up their communications about the importance of promoting COVID-19 etiquette and prevention measures. They're especially focusing on the bar and restaurant industry, and maybe in Burley-Morton, they're focusing on the sandbar industry as well, but reinforcing the North Dakota Smart Restart guidelines help keep both employees and customers safe. Also, as we did in Cass County, the task force will continue to work on identifying distributed sheltering opportunities for those who might test positive for COVID-19, who may either be homeless or who are living in other congregate housing settings but don't have any options to go elsewhere. And so again, they're going to continue to work to identify options to help us slow the spread. And again, the local public health units here, both in Burley and Morton, are highly involved with the school districts in helping them prepare. The task force education and outreach subgroup is working on ways to target the 20 to 29 demographic on social responsibility messaging, make sure that that age group is taking it seriously. And again, this is really important as we head back into college. And if we take a look at the numbers, you can look on the dashboard on the 20 to 29 demographic, but it's one of the areas where we're seeing growth in number of positive cases. And so again, we encourage North Dakotans of all ages, but if you're young and healthy and think this doesn't relate to you, again, please get yourself up to speed and educated about the fact that you can be feeling healthy but asymptomatic, which means it'll still be contagious. So you can feel great, but you can still be a carrier, and you might be affecting the lives and the livelihoods of either the businesses that or the schools that you're attending, or loved ones of your friends that may become infected. So again, important to know your status. We'll talk a little bit more about university testing going back, but in the meantime, whether you're 20 to 29 or whether you're any age in North Dakota, we know that that the way to lower the rates is to lower the number of transmissible moments. This virus can only live when it can move from one human body to another. If we can give it a place to not live, that's what we need to do. And one way to do that is keep 6 feet apart, wear a mask when you can't social distance, wash your hands frequently, avoid touching your face, and of course clean and disinfect surfaces. As I did talk about again earlier, but Stark County is another county we're keeping an eye on. 121 new cases just in the past week. There's now 135 active cases, and again, because of the high rate of 44 active cases per 10,000 residents, that's the second highest actives per capita in the state, behind Burley Morton. And so again, we want to remind everyone in Stark County to be North Dakota smart, and anybody that might be visiting Bismarck or Mandan or Dickinson, same as well, to be sure to again maintain your North Dakota smart protocols. Next up, we want to talk about the K12 Response Team. We know across the state this week, thanks to the leadership of local school boards and local school superintendents and teachers and families and parents, that we do have schools that are starting school this week in North Dakota. And for those that are beginning that journey back into the buildings, again, we kept school going last spring through heroic efforts of parents and teachers and administrators and school boards, but we were doing that schooling without the benefit of the buildings. Now bringing the buildings back in play and putting people all together increases the risk of breakouts and spread. We know that, and we know that there's going to be positive cases that occur in schools, and we have to be ready to respond. And so that's why we've created a K12 response team, which we're calling the Healthy Return to Learning Team. And this is a diverse set of subject matters and experts, the Department of Health and DPI teaming up on this, and here to tell us more about the work that the Healthy Return to Learning team has been doing to help us get ready for the inevitable this fall is Superintendent Basler. Welcome back, Superintendent Basler.
Thank you again, Governor Burgum. As Governor Burgum said, currently we have schools starting this week, which is a happy and joyous thing for us all. Some even just started today, and I've seen Facebook posts and kids coming back into our classrooms and our hallways, and they haven't seen each other and been in those environments since March 13th for some of them, so it is a joyous day. Teachers have been in schools receiving training and information for the past several weeks. School administrators, as the governor said, have been working with their school board leaders, families, teachers, and communities to develop both distance learning and health and safety plans. And we've heard from many of them about the issues that are arising and the needs that exist in our state to make this return to school buildings and the reimagination of K-12 learning successful. To that end, the North Dakota Department of Public Instruction, the North Dakota Department of Health continue to work as one in government to develop solutions that address the needs of those we serve in our communities and across the state. We have created a state response team to meet those needs. The Healthy Return to Learning team is a diverse team of subject matter experts collaborating with state agencies and communities to provide resources, processes, and strategies that schools, local public health, and the state need to keep schools operating and open in their dual mission of high-quality education for all students while ensuring public health. These subject matter experts include a local physician experienced in infectious disease, a local public health administrator, and an experienced K12 school administrator, being supported by the Department of Public Instruction and the Department of Health. The objective of this team is to ensure preparation and response activities for communication are timely and effective. The goal is to protect students and staff from the virus so that educators can deliver that high-quality education to all students. We are so fortunate to have skilled school administrators and health providers across the state that work in their capacity to optimize students' return to school in a safe way. As the situation with COVID-19 evolves, we know there will be situations that our education system has never experienced before. The Healthy Return to Learning team was created to help schools and local public health units through those experiences. The Healthy Return to Learning team has created a concise playbook and accompanying tools for schools and local public health units to utilize as they work through the diverse scenarios they will encounter this school year. As we work to finalize the playbook, the remaining item we are finalizing is ensuring that your personal health information is protected and only accessible to those who require it to make informed public health decisions. The responsibilities of this team include develop Healthy Return to Learning Smart School Response Guidance, serve as key resources to school administration, coordination across state and regional supports, support local public health and state health officials, respond to health and epidemiology questions, and facilitate connections with the Department of Health, local public health, DPI, and local school districts. You know, 6 months ago, I could barely say epidemiology, and now it just rolls right off my tongue, which is kind of interesting. But in conclusion today, I do want to say that getting kids in school is one thing. Keeping them in school will be the tough part. School administrators, school boards, and local public health teams are working so hard to get our kids back in school and keeping them there. But we can't do this alone. If we could have been able to do this alone, we would have done it months and months ago. We need each and every person in our communities to help us keep them in school. We all know, and we say it frequently, that we want our kids in school full-time. But if that is going to happen, we need everyone doing their part. I know a lot of people don't like the decisions that our school boards, some of our school boards have needed to make for hybrid or distance learning. And we are often asked at the department, and I'm sure school board leaders and school administrators are asked even more frequently than we are, how long do we have to keep our kids at home? How long do we have to remain in hybrid or distance learning? And I guess the answer is, well, if we want our kids at school full-time, we have to ask ourselves, what are we going to do to get these numbers down? So I'm asking every one of you, let's do our part. Stay home and order takeout. Think twice about hosting those large gatherings. Our students sacrificed so much this spring. They sacrificed a great deal. They gave up band festivals, state track meets. Some of them even gave up their graduation to do their part for our state, to flatten the curve. And it worked. We were able to keep those numbers low. We were able to enjoy some things during the summer. But now I ask you, that at this point in time, can we as adults do what our students did for us this spring? Can we do the same thing for our students to get our numbers down so they can go back to school with their teachers and stay there? I know that if any state can do this, North Dakota can do this, because we care about our children, we care about our students, and we have a long history of putting our students first. And so I know we can do this. It just means that we have to sacrifice a little bit like our students did for us this spring. I've said often before that I believe that this generation in our schools right now have the opportunity and all the characteristics to be the next greatest generation. So let's help them get back to school so they can continue their learning with their teachers in person. Thank you.
Thank you, Superintendent Basler, and thank you for your leadership, and thanks to the Department of Health and everybody who's teaming up to work on the healthy return to learning team that's working on all this. And again, appreciate and support your appeal for all of us to do what we can to help our students get back in school and stay there, and also to protect all of those teachers that are doing a great job being with those students every day. Next up, we're going to talk about university testing. And as North Dakota students head back, not just to K12, but college students are also around the state are packing their bags. Thousands of them this week will be voluntarily going to one of nearly 50 statewide sites to be tested. This is as we move towards reopening our colleges and universities this fall. The safety of the entire campus is a top priority, and testing plays a role in that. I think the universities know, and the students know, the faculty know that getting tested before you return to campus will not only help ensure you as students, but your friends, families, and teachers remain healthy as you start the year. So to find the test site nearest you, you go to www.ndus, North Dakota University System.edu/get-tested, and get tested approximately 5 days before your scheduled arrival to campus. You know when you're going to be heading off to campus. Back that up. Register in advance at testreg.nd.gov. And again, that's at the ndus.edu site to learn more. Site will be updated as more information is available, so check frequently for the scheduling event, a testing event scheduled near you. As you know, that one of the things that North Dakota led on early and continues to lead on, it has to do with using technology to help in the efforts on contact tracing and slowing the spread, saving lives and livelihoods. As we discussed earlier this year, the Health Department is involved in launching a new Care19 alert app. This is a new tool, an entirely new app designed to protect lives and livelihoods. And North Dakota is the first state in the nation to launch this app in the fight of COVID-19, and we're the first state to connect an exposure notification system with a national key server. This makes Care19 a vital resource in keeping schools and businesses open while maintaining personal privacy. This new app provides proactive alerts and notifications based on anonymous keys exchanged between smartphones as you perform your daily activities. And this Care19 alert uses the Bluetooth proximity technology that was jointly developed by Apple and Google. Exposure notification, there was a lot of press about that back in May. And again, this technology and this API as application programming interface can help reduce the burden on public health staff by unlocking the ability to quickly scale their efforts through close collaboration with developers, governments, and public health providers. We would plan to harness the power of technology using a privacy protective design. And before we bring up, or as a way of bringing up Vern Dosh, who's going to be coming up here to the podium to speak. And again, I want to thank Vern for his work. As people know across the state, Vern Dosh, one of the top tech CEOs in our state, built an amazing company and has voluntarily come out of retirement to work to help us throughout this pandemic. We're super grateful for Vern to being here. He's been at the podium before. And as a way of introduction, we're going to kick off with a brief video from Apple and Google that shows how this technology is going to be deployed, not just in the United States, not just in North Dakota, but literally around the world to help get the phones in the fight, if you will, to help us at a global level slow the spread of this virus. So here's the video, and then following that, Vern Dosh.
Battling COVID-19 is an unprecedented global challenge. To get communities around the world back up and running as quickly and safely as possible, public health authorities are building smartphone apps to help with contact tracing. Contact tracing is one of the best ways to stop a virus from spreading. It can take thousands of disease investigators to alert everyone who's been in contact with people who've tested positive. But even if disease investigators do their jobs perfectly, alerting the people a COVID patient doesn't know or can't remember is incredibly difficult. Smartphone apps that public health authorities build can help people at risk of infection get notified much more quickly. But a contact tracing app works best when more people download it. And being asked to download an app without knowing how it will handle your personal information might cause people to worry about their privacy, and they may not feel safe participating. That's why engineers at Apple and Google have been working together to make public health technology that protects individual privacy, so that people never have to choose between their privacy and the health and safety of their community. You're probably wondering what that means and how that all works, and we're going to walk you through it in a second, but first let's be really clear about a couple things. First, apps using this system cannot track your location. And second, this system does not share your identity with Google, Apple, or other users. Here's how that works. For every phone that's opted in, our technology disguises your identity by generating a random sequence of numbers that change every few minutes. Then, using Bluetooth, anytime your phone detects another phone close by that's also opted in, the two exchange those random numbers. If in the future someone's positive for COVID-19, they can report that positive result in their app. Any phones that had exchanged random numbers in the last 14 days will receive a notification that they may have been exposed to COVID-19 without revealing their identity. Public health authorities can then help anyone at risk get testing and treatment. But it's up to all of us to help with contact tracing. Do your part and look for your public health authority app that uses this exposure notifications system. The more people who participate, the sooner we can beat COVID-19 and get our communities back on their feet.
Thank you, Governor Burgum, for the opportunity to talk about this exciting piece of technology. It was back in April when I first visited with you about the first iteration of the Care19 app, and that was Care19 Diary. And since that time, about 37,000 North Dakotans have downloaded the app, and I'm very convinced that that app has been a very important contributor in the success that we've had with contact tracing. So today, 4 months later, we talk about the next evolution of contact tracing apps. And as the video said, you've all heard about the initiative between Apple and Google. And I don't know that the average person understands how significant that is, that these two arch rivals would contribute resources, their best and brightest, literally from around the world, to build an app that could be used as a tool to try to combat Care19. So the first iteration of our approach to this was an app built on GPS technology. That was the Diary app. And there may be some confusion saying, well, Diary, now it's Alert. It's not either or. It's both. And North Dakota really is the only state in the nation that has said, look, we're not going to ask our citizens to choose. We are going to give them the option to use both. So we have built apps in both arenas. GPS, which is the Diary app, which records locations. It's a diary of your locations, which if you're in certain parts of North Dakota where we are kind of naturally socially distanced, that app works very well. But as we listen to Superintendent Basler and as we listen to the university presidents prepare for their students coming back, it's very difficult, it's daunting to do contact tracing in an environment where the average college student probably has 40 to 50 contacts over 14 days. How do you do that? How do you trace those individuals when perhaps you don't even know their name? You're brand new on college campus. There's no way that you're going to know their name. There's no way you're going to be able to trace those effectively. So we employ technology. We embrace the exposure notification technology that Apple and Google have built. And I got to tell you, it's been such a learning experience to be on the calls with Apple and Google employees, literally the best and brightest from all over the world, along with our very own from Proud Crowd. And they have done an amazing job of being active contributors to the development of this app, which literally will be used, and this technology that can be used around the world. So, as the governor mentioned, the Alert app is based on Bluetooth technology. It's the very same technology that you use for your earbuds to communicate to your smartphone or your wireless keyboard to communicate to your laptop. It's the same technology. And this technology, rather than being interested in where you're at, it's identifying perhaps who you've come in contact that is a close contact being defined as, within 6 feet for 15 minutes, okay? So we're trying to leverage technology to do the job and to automate what has largely been a manual process, and that's contact tracing. So I want you to think about contact tracing and the Alert app as like a virus piece of software, an antivirus piece of software on your computer. Most of you have them. Many companies mandate an antivirus piece of software, and you load it once and it just works in the background. It's looking for the virus. It's looking for an infection, and its role is, if it finds one, to quarantine it and get it out of harm's way before it can do more damage. That's a pretty good analogy for what we're trying to accomplish with Care-19 Alert. We're trying to isolate any contacts that may be in danger. And we do that with the Bluetooth technology. Think about your phone. After you've loaded Care-19 Alert and you've activated Bluetooth, think of it as a beacon in your suit or in your briefcase or in your purse. Think of it as a beacon that's constantly sending out that signal, looking for others that are within that close contact criteria that are using the app also. And if you're in that close contact criteria, if you meet that 6 feet for 15 minutes, it's going to exchange a key. It's pinging that other phone. It's sending a 32-digit encrypted signal to that phone. And what you have on your phone when you're using the app is like a digital list of close contacts. Hope you never have to use them. Hope you never have to reference those digital contacts. But if you are tested positive, what the software will do with the authorization of the health department is allow you to notify those who have been in close contact with you. When you send the alert out, they don't know who you are. They don't know where they were in close contact. They just know that sometime in the last 14 days you've met that criteria. So it's really a fairly straightforward technology. But if you ask me, and I'll answer the question before it's asked, what's the biggest hurdle? It's people's perception. Whether it's GPS or Bluetooth, it's people's perception that this is something nefarious that the government is doing to track me. I would tell you this, and the words were said in this video, and I want to repeat it because it is at the heart of how we approach this project. We never want to put you in a place of having to choose between your privacy and the health and safety of our citizens and of your families. We never want to put you in a place of having to choose between the two. It's both. We have to protect your privacy, and we have to leverage every tool we have to make sure we're keeping our citizens safe. I just ask that as you're considering Care-19 Alert, that you do make that decision on an informed basis. I will tell you, if you go out to Twitter or Facebook, there's all kinds of conversations and all kinds of strategies that unfortunately are misinformed. I just ask you to be informed, and it's our job to help you understand the technology, to answer the questions you may have, to remove those obstacles. Think of all the software tools you use every day on your smartphone. I would submit to you that Care19 Alert is going to be the most important app on your phone. It's not about how you communicate. It's not about how you get your news. This is about protecting lives and livelihoods. And I know we're all tired of isolation, and we're tired of COVID. And this is a tool. We're taking every tool out of our tool bag to throw at this. And we know nothing is 100%. Contact tracing, testing, social distancing, wearing a mask, downloading Care19 Diary, downloading Care19 Alert. None of those things are guaranteed 100% to protect you. But you layer the different pieces of security, one upon the other. And the more you do that, the more closely we come to the place where we can return to normalcy, and that's what this is all about. I ask you to seriously consider this app and do it from an informed position because, as they say, hashtag we are in this together. Thank you. Governor.
Thank you, Vern. And as Vern said, we're in the world of and, not the world of or. This is an opportunity to have your data on both these apps protected, but still participate in helping to slow the spread. And I would say on a give-get basis, you don't really have to give anything. These apps are free. So there's nothing you have to give. You don't give up your own personal data. You don't give up any financial cost. It doesn't burden your phone bill, but if you do that, what you get is you get a chance to help save the lives of others, and so this seems like an easy trade-off. And again, if you're a college student heading back to college, I would absolutely make sure that you've got these apps on your phone. And if you've got a loved one who's vulnerable, or if you're someone who's listening to this and you're vulnerable, I would make sure that you download these apps as well, because these are tools that will help save you if you get exposed to COVID at some point in time. So thank you again, Vern, and thanks to the team at Proud Crowd and for working with Apple and Google and helping North Dakota be a leader in using this technology, which will be spread around the world. The key notification that we talked about in here is the National Key Server. Apple and Google are going to authorize only one application per state, and those have to be approved by the state health department. So that's gone through the cycle here. So again, thanks to our own North Dakota Health Department for their role in this as well. The next up that we're going to talk about is isolation and quarantine reminder. And we've talked a lot about testing, tracing, and isolation. And you've probably heard us talk more about testing than any of those three, but isolation and quarantine is the most effective way to spread. So the spread, if we do a great job of testing, but we aren't doing a good job on the quarantining and isolation, then we're losing the value of all of the effort and time we're putting into the testing. So we want to talk about this other element on the other third leg on the stool, if you will. And we know that this is sometimes it's not convenient, it's not easy sometimes, but it is temporary. And getting compliance with isolation quarantine is absolutely a way to save lives. So here to break it down for us, Molly Hall, our Immunization Program Manager, North Dakota Department of Health. Holly, thanks for being here today, and thanks for everything you've done during the pandemic.
Thank you, Governor Burgum. So today I am going to be discussing isolation and quarantine. There's been a lot of confusion out there about what the difference is. If I'm a household contact, is it different than I'm a workplace contact, things like that. So I just wanted to clarify a few things for the public. And it's especially important with school and university starting because we don't want close contacts going to school and potentially spreading COVID if they go on to develop COVID to others. And so just to start off, I'm going to start off with people who have tested positive for COVID-19, which as an epidemiologist, we also call them cases, if you hear that term. People who test positive for COVID-19 need to stay home for 10 days from when their symptoms first start. And so the day that their symptoms start is day 0, and then you count out 10 days after that. And that's how long people who are positive need to stay home. And they need to stay home, which we call isolation. So they need to isolate themselves from others. No, they shouldn't be going to work, they shouldn't be going to school, not going to public gatherings, anything like that. Now, there may be other people in the household with them. You know, we can't always avoid that. As much as possible in the household, we want people to try and, you know, not share the same bedroom, if possible, not share the same bathroom, and try and keep a 6-foot distance away from the person in the household who's positive. For people who don't have symptoms, not everybody who has COVID-19 has symptoms. We do have people who are asymptomatic. Those individuals need to isolate themselves for 10 days from the date of their collection. And so collection date of the test or of the specimen when you go in to be tested is day 0, and then you count out 10 days after that. And that's how long asymptomatic people need to stay home. Some people, when they're first tested, are asymptomatic and then go on to develop symptoms. Those people, then their 10 days starts when their symptoms develop. So for cases, isolation is 10 days. Now I'm going to go on to close contacts. And so as Vern mentioned, a close contact is someone who is within 6 feet for a total of 15 minutes. And so if you've been identified as a close contact to someone who's tested positive for COVID, you need to remain home for 2 weeks or 14 days. And so day 0 is the date of the last time you were exposed to the person who is positive. And then you count out 14 days after that. Close contacts need to stay home or quarantine. So contacts quarantine. They need to stay out of public places. They shouldn't be going to school or work or social gatherings or anything like that. Being a close contact does not mean you are going to for sure get COVID-19, but you are at a higher likelihood of getting COVID-19. We are also recommending that close contacts be tested for COVID, and we recommend they're tested about a week after they're last exposed to COVID. Even if you test negative while you're in quarantine, you have to complete your 14-day quarantine. We've had a lot of people think, oh, I tested negative, you know, I'm on day 9, I can go back to school, I can go back to work. No, you have to stay home because it can take up to 14 days to develop COVID-19. And then if you're a close contact, but no one else that you live with was identified as a close contact, those individuals don't have to stay home. They're contacts to contacts. So it's just the close contacts to cases that have to stay home in quarantine. And so now I want to talk about household contacts to cases a little bit because there are some slight differences there. And so because you're in a household with someone who tested positive for COVID-19, you're continuously exposed to them while they're still contagious and could spread the virus. And so you need to stay home during that case's 10-day isolation period, but then you have to also add the 14-day quarantine period for yourself to that, because it could be, you know, you're continuously exposed for 10 days, and then it could take up to 14 days to develop COVID. So it is possible if you're a household contact, a contact tracer may tell you that you have to stay home for up to 24 days. And so I just want to mention that, as said before, isolation and quarantine are one of the many tools to reduce the spread of COVID-19. And I know it's frustrating and it's not fun when you probably get a call from a case investigator or a contact tracer, but this is what we have to do to slow the spread of COVID-19. And we really appreciate everyone's help in this. And if we all participate, and it's just a short, I mean, I know 14 days, 24 days seems like a really long period period of time, but in the whole scheme of things, it's not that long of a period of time. And so if people can just really comply when you get that phone call from the health department, we can really reduce the spread of COVID in the state. Thank you.
Thank you, Molly, for that important refresher. And Molly will be available for questions afterwards, as will the superintendent and Vern. Next topic is Economic Resiliency Grant Program. As you all know, the North Dakota Department of Commerce began receiving applications for the ERG, Economic Resilient Grant Program, launched last Wednesday. They've received over 25,000 applications. They have more than 40 dedicated reviewers. They're diligently working to go through the criteria to make sure the applications for the grants meet those criteria, and then working quickly to get those funds into the hands of North Dakota businesses. And of course, these are funds that were approved by the budget section of the legislature and the Emergency Commission that came from the federal coronavirus relief funding that the state received. The purpose of these benefits, or the purpose of these economic resiliency grants was to help businesses in making infection control improvements that inspire consumer confidence and get consumers to return safely to the marketplace. 9 different industries have already been awarded different funds. There are several more industries in the queue. 280 communities are represented in the range of applications received in the 2,500 applications, and they go from industry to hospitality to childcare to medical services. A number of examples of grants that have already been approved already, including a large childcare center in Grand Forks was awarded dollars to install touchless faucets and automatic doors to eliminate repetitive touch by staff, parents, and children. We had retailers that have been awarded grants to install air purification systems. We've got fitness centers that have got a new cool technology that have disinfecting fans, ceiling fans, and then hotels with the spray disinfecting, handheld, and backpack sprayers to help them quickly disinfect their facilities between customer turnover. So there is still some dollars remaining. The Economic Resiliency Grant application window will remain open until August 28th for the first round of funding. And again, where you go find out more information of that is ndresponse.gov through the Economic Resiliency Grant banner, which is at the top. So again, thank you to the Commerce team and thank you to the legislature for approving these important grants for North Dakota businesses. Next topic is behavioral health update. And again, we know that through this pandemic, while we've been dealing with the physical risks associated with a potentially deadly virus, particularly deadly for those with both age and underlying health conditions. We also know that mental and behavioral health has been a challenge for individuals, for families, for communities, and across our nation. According to CDC data that was released just this week, there was a 40.9% increase in respondents who completed surveys during June that reported an adverse mental or behavioral health condition. Almost 31% reported symptoms of anxiety or depression. 25% reported traumatic or stressor-related disorders, and 13% said that they were using substances to cope with the pandemic stressors. And of course, we know that the risk of the disease of addiction represents a whole new set of health challenges as well, which is again why we're working so hard to get kids back in school and get help save lives and livelihoods so that we can help address these other health issues that are touching so many Americans. One very concerning point that came through this was the risk of ideation for suicide. Again, that would be a question of have you had thoughts of suicide? between ages of 18 to 25, this was in the June CDC survey, that increased 25%. Unpaid adult caregivers, people that are caring for other loved ones, 30.7%. And essential workers that were working throughout this whole event, 21.7%. So these high rates of mental and behavioral health conditions and increasing risk for suicide are things that we all need to be caring about as individuals, as families, and as communities. North Dakota state and local response will continue to include intervention and prevention efforts to address behavioral health needs. And again, we want to continue to encourage family members, friends, and neighbors to reach out and support or assist loved ones in finding the support or services they need. If there's someone that you know, a loved one or a friend or a family member that you think is exhibiting symptoms of anxiety or depression or other stresses that may be compiling during this time, you yourself can call to 701-223-1510 or go to projectrenew.nd.gov to learn how you can access support services for your loved ones, or you can encourage them to call directly. But again, for more resources on what to say to those people that you may be concerned about or how to support those, go to behavioralhealth.nd.gov. Next up is gratitude. And as we've often said during our section on gratitude, we've talked about the National Guard in North Dakota. The National Guard's done incredible work. For most of the pandemic, we've had more than 300 soldiers that have been called up, performing a variety of duties. When we were putting in an application this week to the federal government for 100% reimbursement versus the current 75%, we were describing to the White House about how the Guardsmen have been involved in all of the work that we're doing to keep our Department of Health testing lab going around the clock, all the work that they've been doing on the remote testing locations, all the work that they've been doing on transporting samples. And I think way over 50% of the tests that have been done, which is now I think over 360,000 tests, that over 50% of those have been touched at one point or another by someone from the Guard. So while there's a lot of people to thank in the Guard, there's one that I particularly want to call out who's been a real standout. And as part of that gratitude, it's bittersweet that today I'm accepting the expected resignation of Dr. Andrew Stahl as our interim health officer. I want to thank Dr. Stahl for his work, incredible work. As a member of North Dakota National Guard COVID-19 Task Force since March, he's been providing strategic medical analysis for our COVID-19 response efforts, and then he stepped up to fill the vacant position on June 1, and throughout the last 3 months he has worked tirelessly, literally some days working 24 hours a day. As he told me when he took this step into the interim role in June, that his intent was to return to his previous clinical practice, and he has informed me yesterday that he'll be doing that, and his last day with the health department will be August 31st. But we're deeply grateful for Dr. Stahl's dedication and service to the state during this incredibly challenging time. And under his leadership, the North Dakota Department of Health during the last 3 months has continued to lead the way in protecting public health, partnering with state, local, and federal and tribal agencies to save lives. And again, Dr. Stahl, again, through the National Guard, we're so fortunate. The timing of this, he's been a member of the North Dakota National Guard, and he was called up here, but he was also had received an offer to join private practice here in Bismarck. His wife is also a pediatrician, and she's moving to Bismarck. They've got a 20-month-old child and another one on the way, and so we're grateful that the Stahl family and their growing family is going to become full-time North Dakota residents here in Bismarck, working for Sanford. And so congratulations to Sanford on a great hire, and congratulations to Dr. Stahl, and thank you. I do want to also say again that this is probably the most challenging position in state government right now as the public health officer, and again, finding individuals that are willing to make the sacrifice. All people in state government make the sacrifice, but when you're you're someone who's got a medical license and practice and a young family, and you've maybe taking a pay cut of 50% or more to come and get involved in this with all the challenges, it's really incredible. So when we talk about our National Guard in North Dakota and how great they are and how they're always ready and always there, Dr. Stahl exemplifies that to the max, because when we asked him to step up, he did. He made a tremendous sacrifice financially and also in terms of time away from his family over the last 3 months, and so we're deeply grateful for the great work that he's done. A search is underway right now for a replacement for the interim health officer, and a permanent position will be posted soon. With that, I want to say again, thanks to all of you for tuning in. We'll be back here Wednesday at 3:30, and until then, make sure that you continue to be North Dakota smart. Thank you. Who's going with Jack first?
Why is the statewide hospitalization number considered public information, but the citywide hospitalization number is considered a protected disease control record? And I guess I'd just point out that you've said this is the public's data, and last month you discussed hospitalizations on the county level, even down the numbers of ICU beds.
Well, I think as we're all continue to learn more about the intersection of both state and federal guidelines around public health information, there is both a numerator and a denominator, and so the more identifiers that you release around personal health information, one example might be age, might be gender, might be the condition that they're diagnosed under, not just COVID, but any other condition. The more specificity you have on that individual, the more you are at risk of people being able to identify that individual. And if you have large groups of data, large denominators, then you could release more personal identifiers without people being able to understand that. For example, we've used in the past is Florida, where they have got large numbers of cases, where you get to a place where you've got hundreds of thousands of cases, like in New York, Florida, California, and hundreds of thousands and growing rapidly. If you give out a zip code, and that one zip code may be a small area, but it's got the same number of actives or same number of cumulatives that we have as a whole state, then you're not really giving out with a bigger denominator, you're not allowing someone to potentially reveal their personal information. But we know that here in North Dakota, for example, when we looked at the zip code information, which we were aspiring to potentially release, we know that in some zip codes there might have only been one case, and so if you release it by zip code, and you say, and we've already said here's a person's age and gender, now we say their zip code, it might be pretty easy to identify them. So we have got both the benefit of being a small state has a lot of benefits, but in terms of releasing information, sometimes our denominator is too small in terms of doing this. So we're working every day, working on it right now to try to figure out where we can protect people's personal information, but give enough information for public information, and particularly as we get back into the school situation, we're going to have a lot of questions that will arise about information, below the county level, because we've got some counties that might have, one building and one high school, and we've got other counties that might have 30 or 40 or 50 buildings, and so for a superintendent to only get information at the county level, that might not be very helpful for them. In a very rural county, it might not only be operationally effective for the school district, but it might be releasing personal information. So we're going to have to just keep working through this. We had another meeting on it today to try to strike that balance. It is obviously, again, we want to make sure we're following the full letter of the law around this, which is both state and federal, but we also need to make sure that during this time of emergency that we're getting information to leaders so that they can act on the best for all of public health safety. So.
Follow up to Do people have direct interest in how many people are hospitalized in their local area, what the capacity is at?
Yes, they do have a direct interest, and so there is a public, you can make an argument that there is public, just like people will make the same argument. You know, as parents, they'll say, don't we deserve to know how many people and what ages and what classrooms were people that tested positive at a university or a K12 school? I mean, those questions are all coming at us and coming at us quickly, and that's why we're trying to work through and navigate all of the various laws and risks associated with that. And this is non-trivial, and it's non-trivial particularly for people that are in health professions that have medical licenses and are in a position where they want to, and that medical license which they've worked and they've earned, and that's their personal livelihood, being involved in inadvertently or inappropriately relating personal health information can come with some pretty high federal penalties. And so we have to, the people that we're asking on our public health team to work on this, and the people that we're asking across all of the hospital organizations, we have to make sure that we're being very thoughtful about not putting any individuals at risk. At the same time, we're trying to serve the public good. Both the individuals that have their own personal health information, the people that are making the decision about can we or can we not legally release it, and balancing that with the public's need to know. So it's happening in all 50 states. It's happening around the country, but this is a crux of one of the difficult, challenging decisions that we're dealing with every day here in state government. Jeremy, and then Jacob, and then Dave. We'll go right around the horn.
Governor, I'm wondering if before Dr. Stahl offered his resignation, he had expressed any favor for mandating masks, and if that was an issue or I guess a point of contention between your administration and his thinking.
There's never a point of contention between Dr. Stahl and myself. The state health officer, whoever would fill that role, my expectation is that they'll come forward with the recommendations that they feel are best from a standpoint of public health, and then we have to make decisions and provide guidance to the state based on that. But we've always run our office more on a the famous book that talked about Lincoln, but the team of rivals. But one of the things that I really value is having different opinions in the room, and so when Dr. Stahl has had opinions or strong opinions about particular points during this time, and the same with Mylyn Tufte when she had strong opinions. I valued those, and this is part of what our expectation is, because we're at a time when you're in uncharted waters and you're dealing with new challenges every day. Having multiple different opinions is actually a plus, not a minus.
Did he mandate, or did he advocate for mandating masks either at a county level or a statewide level?
That hasn't been part of the discussion. We've had some good discussions, including again today, about whether or not the sort of the guidance that we're giving, which is again not law, but the guidance about are we are counties like Burley Morton, should they be yellow or should they be green? We've moved the dial closer to the yellow. It still sits in well, we didn't show it today. In my mind, it sits closer to yellow. The trend line's going the wrong way, but those are the kind of good, I say with how to say tongue in cheek, but good healthy discussions that we had about the guidance that we should provide as a state. But overall, of course, there's a lot of things that we're in complete agreement on, which is the great heroic efforts of on the testing front, and the fact that overall as a state our numbers are better than just about every other state. So we're in a good position to be debating some finer points. Jacob?
Sorry, but it seems kind of unlikely that the two of you didn't discuss a mask mandate at any point in the 3-month span that he was in office or in his position. How does that happen? How do you not discuss that kind of thing with your interim state health officer?
Well, it didn't happen, so I can't explain necessarily, but I think maybe it's because Dr. Stahl, we've been working with him since March, so he's been here since the very beginning of the pandemic. I mean, he's one of the first people that called up. He was part of the unified command, and I think he understood that we were on a strong effort here in our state to have a light touch of government, and so again, at that point, I just would be speculating on why it didn't happen. But I know that he supports masks, just like we support masks, just like we've got the mask up North Dakota. I mean, so I think we're on the same page. I think when we've talked about mask mandates, medically masks are effective. Mandates may not be effective. A mandate is, the minute I would stand up here and announce a mandate, the hands would leap into the room, and the next question would be, how are you going to enforce it? And we're not in North Dakota. We're not going to walk around and be fining people like some other states have tried. I think you know how ineffective that has been. And so I think we're trying to find the balance between education, personal responsibility, and doing things that practically can be implemented, as opposed to things that, again, how many times you guys have all heard me say it's about what individuals do. It's not about what government says, and mandates would fall into the government says, bucket. Dave?
Just to follow up on one more thing, you said that Dr. Stahl is leaving officially on August 31st. It is your intent to have an interim in place September 1?
It'd be great if we could. As Dr. Stahl and I talked about today, filling this position is tough. We were pleased to have someone like himself make the personal sacrifice, the financial sacrifice, the family sacrifice to step in this role. When he took it last June, we knew it was going to be for an interim period of time, and a lot of great accomplishments got done during that time frame. But initially, when he started talking about this, he sort of set 4 months as what he was thinking about. He's given us 6 months of his time between the 3 months through the March, April, May with the National Guard, and 3 months in the state health officer role. And I understand when you're making the kind of sacrifice that he's been making, why you'd want to get back to private practice. And I'm sure his employer's anxious to have him back too. I'm gonna flip to this side, Jeremy, if I can. We'll go online, and then Lane, did you have your hand up too, or not? Okay, we'll go online.
Eric Arndt with KZZY. What is your response to local county officials who have concerns about being able to adequately staff in-person polling sites this fall, given that rural counties in North Dakota typically have many retirees serve as poll workers, and the flu and coronavirus could be circulating in early November?
I don't have a lot of concerns. I think we have enough lead time between now and November where counties are going to have to do some work. If you've got somebody who's 75 years old with underlying health conditions, probably might not be the best choice for them to, sit at a poll all day. So, maybe a good time for civic engagement, get some people that might have not done it before, get some training for them, get some younger people involved, younger, healthy people. But then also they've got time to set up their polling locations with more signage for spacing, setting up times to do that, making sure that the poll workers and masks. This might be, again, something where to protect poll workers, a county might say, look, if you're going to come in and vote, we ask you to wear a mask. We'll provide them during the time that you're in this facility doing that. So I think there's a lot of mitigations where you can do that. And again, when we're, talk about close contact, Molly was up here today, 15 minutes within, 6 feet. I think there's a way to get voting done and maintain social distancing and not be 15 minutes. Now, there's been times in my life when I voted in North Dakota when I stood in line for 2 hours to do that. The last hour of the last day of the election, you probably we'd want to try to anticipate that and figure out a way to make sure that we don't end up with people in crowded conditions. But there seems to be plenty of lead time for people to manage that. And of course, if someone's concerned about voting in North Dakota, you can always apply for and receive a absentee ballot and vote that way. That would take pressure off of the number of people showing up on election day. Lane?
I actually have a question for Vern Dosh.
Thank you very much, Lane. We have Vern Dosh coming up.
Yes.
So I've seen a lot on social media lately, people posting photos and videos specifically related to iPhones already having a COVID-19 locator I do not have an iPhone, so I don't know exactly how that works. But what's the difference between that and these Care19 apps?
It's a good question. And the work that Apple and Google did, really, it was not developing an app. In North Dakota, Proud Crowd developed the app. Apple and Google developed changes to the operating system that they refer to as exposure notification. So if you have one of the most recent versions of those operating systems, and on iOS, if you go to System, Security, Health, you're going to see a indicator. It's a slide bar like it is for every other, whether it's Bluetooth or location, whatever, and you have to opt in. It's loaded in the operating system as being off. It's disabled. You have to opt in order to load that app. So it is there as part of the operating system, but you have the option to activate it or not.
So they're basically the same thing, it's just Apple's already put that in as part of their operating system?
Yeah, and Google has put it in the Android operating system also. So they have an API, which is just an interface. It's the way the operating system talks to the app. And so Proud Crowd in the Alert app that they developed accesses that integration point and accesses the exposure notification functionality. Yes.
Jean Shemp, Hometown Radio Group in Minot. There are cases in the Minot area, or there were reported cases in the Minot area where positive patients haven't heard from contact tracers as many as 4 or 5 days after testing positive. And that, because of that, those that have had close contact with them haven't been contacted either. Is that the typical timeline for contact tracing in North Dakota, or what might be at issue there?
I'll be honest and say that has been a bit of a challenge, but we've been working very hard. I credit NDIT, the Department of Health, with how they have been, as they say, building that plane as it's been flying. Typically, the notification of a positive case happens very quickly. As soon as it's rendered at the lab, Department of Health nurse will call and inform that individual that they are positive. We are just finishing a piece of automation that allow us to take, with the approval of the person being tested, they have to give a consent, to be able to deliver their negative results in an automated fashion, either by email or text. And that piece is just being brought up as we speak. So the stated goal, I won't say that there haven't been some delays, because there have. The stated goal that we are working for, that the governor's office has established for NDIT and the Department of Health, is 48 hours from the time of swab to the result rendering.
Is the notification of a positive the same as contact with your contact tracer?
The notification of the positive would generally come from the Department of Health nurse and would be followed up then by a contact tracer case manager. Thank you.
Vern, I've got a follow-up question. So I think it relates back to Lane's thing. When Lane was asking about the apps that he's seeing on apps, we want to be clear, there's the Apple, Google technology, they're giving out one key per state. So there's only one app from North Dakota that will have this technology. There'll only be one from other states. They have to be approved by the Department of Health. Other countries may have apps around the world that use the Google Apple technology, but if the apps that you're seeing that are out there now that say they're a contact tracing app, unless they're among the first few that have been announced, because was it Wyoming, North Dakota? In Vermont, there's only 3 states that have apps. North Dakota was first last week. I think Wyoming and Vermont were on Monday. So right now there should be only 3 apps available in the US that use the new Apple Google technology, as described accurately by Vern, in terms of you got to go do the slider bar and turn it on.
But they didn't have the key.
Yes, Virginia was first, but they didn't do the national key server. It's just within Virginia.
Okay, so, all right, so first to use the national key server. North Dakota, but Virginia also has their own app out. Okay, back to other questions. Back to Jeremy.
You had mentioned that there were some discussions about that yellow rate versus the green rate maybe for Burleigh County. Was Dr. Stahl advocating for moving that, that risk level up to yellow in Burleigh County or some of the hot spots in the state?
I would say that there's been a good, healthy debate about this, and I would say that there's there have been members, including Dr. Stahl, who have advocated for that we had reasons for some parts of the state to be yellow. But that had nothing to do with his resignation at this. Again, this is something he told us when he started, that he was going to be going back to private practice. We're pleased that he stayed 3 months. We would have been happy to have him stay longer, but understand everything that he's got going on, that this is a good time to do that, and we're going to have to scramble. Because again, very tough to fill, and again, I think what we, I think this highlights during normal times. There's a lot of roles in state government that require someone with trying to find someone with a medical degree, and optimally it would be a medical, be a doctor and have a master's in public health. That'd be the optimum thing. What we pay for that job right now is again, I think it's be very tough to fill, and it'd be we're again grateful that Dr. Stahl filled it for the time that he did. Jacob?
When Dr. Stahl took the position, was it expected that he would only be on the job for only 3 months?
Yes, we talked about that at the beginning. It'd be 3 to 4 months.
If I may then, you said you'll have to be scrambling. If you expected this to be happening, if this is within that time period, what's the scramble?
Well, maybe I'm always an optimist. I mean, maybe I thought we could get him to stay longer, but give us a little more time to do that. But also the other, back in June, our numbers were dropping, nicely during that time frame, and I think there was, some optimism that that maybe there would be less demand for people with these kinds of qualifications. But I think the other thing that we're finding is that, as we try to fill this role in North Dakota, we're competing with all kinds of organizations and private sector businesses and state health departments, everybody that would want to have the kind of expertise that would, combine medical degree with public health background. There's just the most amount of demand increase in probably any profession in the country is people that can do these jobs, and we're not paying enough here at the state of North Dakota to be really competitive. So again, finding another person that would be willing to make kind of sacrifices, that's what the challenges we're up against right now, unless we can find other funding sources. Jeremy?
And just back to that risk level, why not heed Dr. Stahl's assessment of it and his recommendation, and why keep it green?
Well, I think there's, I alluded to this in an earlier discussion. If you're in the medical profession, then you're in in the state health officer role, you make medical recommendations based, strictly on that. I think we've said all along to everybody that we're going to make decisions that are trying to balance the risk in North Dakota, and we're not asking state health officers to take on economic risk, financial risk, legal risk, political risk. That's not what they're hired or paid to do. Those decisions roll up, to this office in particular, and we have to look at a lot of different factors on how we're making those decisions. And one of the things that is that we've said along that we're looking at is hospitalization capacity, and we still have a lot of it, and we're better able to care for people at the highest level of care right now than we were even 5 or 6 months ago. And so that's why I remain cautious, but confident that at the level we're at right now is appropriate. But as I said it right at the first outset today, that I thought the numbers were headed potentially in the wrong direction, and it's something that we would have to consider and are willing to consider, that we would, on a county by county basis, move some people back to the other level. So we're prepared to do that if we think it's necessary. Dave?
This is for Kirsten Basler.
Thank you, Dave. Superintendent Basler.
Question, do you have a rough estimate or a rough percentage of how many schools are going to be totally face-to-face, hybrid, or totally online?
So the question was, do we have a rough estimate of how many schools will be face-to-face, totally hybrid, totally online? We are actually setting up a system right now to collect that information, so so we can have real-time data for you for those questions. I anticipate that number will fluctuate as we move through this school year, so we wanted to set up the system, and we're working with IT to get that done, to give you those real-time answers. But I can give you a rough estimate for today. I don't know of any school district that is going 100% distance. So all of our school districts, we have 174 operating school districts in the state of North Dakota. All of those will be in their school buildings at least some of the time. And I would say that I would probably say about 20%, maybe 25, probably about 20% are in that hybrid. But remembering 129 of our school districts have less than 300 students in them in K12. And so lots of space, lots of room, so they are able to achieve that 6 feet social distancing, that outdoor space, and leverage that. So again, we'll be watching those numbers. We're working with our school districts to develop that system where we can give you that information. And I will also share it, you didn't ask this question, but I'll share it with you anyway. We're seeing that whether it be a large school or a small school, anywhere between 7 to 10% of the students within a school district are choosing to have their children, the families are choosing to have their children distance learn until a different period of time. So, Jacob.
For the Healthy Return to Learning team, there's a number of individuals that have to be a part of these teams. Do the school districts have a certain cost associated with having these members be part of it?
So this Healthy Return to Learning team, this Healthy Return to Learning team is a state team that is being put together. It's the task force, if you will. We hesitated to use the word task force because this team will be together through the school year to assist. And so this team is comprised of 3 individuals that are dedicated those subject content areas, as well as supporting members from the Department of Public Instruction and the Department of Health. Thank you.
Online?
Regarding higher education, the University of North Carolina, Chapel Hill had to move their classes online after they experienced multiple clusters of positive COVID cases. Are North Dakota universities doing enough to keep classes going in person this fall? And in what ways are North Dakota universities differentiating themselves from other schools across the country?
Well, number of questions in there, but I would just start with the premise that the Higher Education Smart Reach Start Task Force went into the idea that they're going to deliver all classes initially, on premise, with the understanding that if one individual tested positive or was a close contact and couldn't come to class, that they'd be able to attend class remotely. And this is, again, part of the almost, I think, over $40 million that went into higher education through one of the grants we made through the Coronavirus Relief Fund, was to try to equip classrooms so that they could be able to be dual in this hybrid model, delivering distance learning and on-premise learning at the same time. That will allow any school, if they end up having a breakout in a classroom or a breakout of cases in a classroom or a building, to be able to transition to distance learning. And so I think that, the intention is to start out with on-premise, and I say again, but all of our 11 universities today provide online coursework. So they were last year and they are this year in the hybrid model because of the increasing number of people that were taking online college courses, but we're more equipped and better prepared than ever before to be able to deliver all content through a hybrid model if needed. And I would expect that the state should be prepared that we're going to have cases in higher ed and we're going to have cases in K-12 locations, and that's one of the things that is expected. And the question is not that whether we have them or don't, but how well prepared we are to respond to them, which is what we're working on hard every day to get ready for that. Back to Jack.
What has the Lieutenant Governor been doing these days, and are you two keeping a distance to ensure the continuity of government? Brent and I have been very careful about making sure that if one of us
tested positive, that the other wouldn't be a close contact. And so we're doing a good job of socially distancing from other, and Brent has been incredibly busy through this whole time on a variety of topics that we would probably be more fun to talk about than COVID. But in particular, I know today, for example, he had a jam-packed day talking about investments in petrochem. Could be some exciting announcements coming soon about some of the things that we've been working on with ethane, with the private sector and ethane capture in the state. He's been deeply involved in all of the work related to Coal Creek. I think, as a matter of fact, today he talked to 4 CEOs today around Coal Creek, because again, very important that we maintain that base load in the state. He's leading the Empower Commission, which of course deals with all of the above energy strategy. In state law, there is an ability for, if the governor is unable to or chooses not to attend a state water commission meeting, that the lieutenant governor can chair that. And so Brent's chaired the last 3 meetings of the state water commission. Of course, we've got a lot of challenges there because the Water Resources Trust Fund is coming in way below. I think we were hoping for $420-some million. We got $180 million in there. So the last 3 meetings have been basically about saying no to the projects that might be shovel ready but are not part of legislative intent. So balancing all that, and of course he also chairs the State Investment Board, which has continued to meet through all this time, and there's a variety of other things. But I'm in regular phone contact with Brent, and Brent participates either by video or by phone in meetings every day. We just have been doing it distance. And our office is a small but mighty 16 people, and since the beginning 8 of those have been working remotely and 8 have been working in the office, and Brent's one of those that's been working primarily remotely during that time, although he was in here today. I did wave at him, but we kept our distance.
Yeah, that was my next question. When was the last time you physically saw each other?
5 hours ago, 4 hours ago. So, but I made sure I was we were distant. I was waving from across his office. Online.
Mike Smith, KEYZ Willis, 660 KEYZ in Williston, and you've touched on this a little already. Do you feel North Dakota still belongs in the green level? And with schools opening in the next couple weeks, do you think moving to yellow in the first few weeks of school could rattle educators trying to acclimate to their district's plan?
Well, obviously the first part of that is yes, because we're still in the green level because we think we're in the right spot. But as you've sort of with the shading, we've got the dial more towards yellow than we do towards blue. And again, one of the things that we'll be thinking about in the days and weeks ahead is again how to make sure, not just with K12 but with other things, because I did mention, again, we're going to dig in some more in the data about any correlation between higher prevalence in a county and the increasing case counts that we may have seen in both in long-term care, both in that may be coming from staff that are in the community. And so we know that I think, as Superintendent Basler made a very strong and articulate appeal, which is that we asked our students to make a huge sacrifice last spring by giving up their spring sports, their spring POMs, their graduations, et cetera. And if what it takes for us as adults is to socially distance and wear a mask, if we can save lives and help get kids back into school where they're going to have better health care, better nutrition, and better education, then that seems like something we should all do. But if we've got places where we've got higher prevalence, not just in absolute cases, but in higher prevalence in terms of the cases per 10,000, that might send a signal to that community that everybody needs to pull together to make sure we're ready for getting back into school. But again, this doesn't all have to come from the state level. We've got local leaders at the county and the city level that, if all the information's out there on the dashboard, local communications, local school boards, local groups, whatever that are emerging around the state to make sure, because this is going to be it's a community, it's a state-led, but it's a local execution is what it comes down to, local public health and local school districts. And we want to make sure that everybody is working as hard as they can in their own communities to make sure that kids can get back to school safe and we can protect those that are most vulnerable. And with that, I think we've passed the top of the hour, but I want to thank all of you for being here. And again, our scheduled time to be back again, barring any emergencies, will be next Wednesday at 3:30 p.m. Thank you all. And if you're a heroic viewer and you're still listening to the very end of Q&A, thank you for that. And enjoy a beautiful, warm day in North Dakota. Thank you.